This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo!
Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetramax Veterinary Supply. Vetramax makes it better. Hey everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary allergist and dermatologist, and
I'm Janet Novotny-King, wearing my name tag. I am co-host to my sister's veterinarian, and I am not a board-certified. I am not medically anything. I am a pet lover and rescuer, and I just adore pets, and I'm here to represent the voice of all of our pet owners. So Yay. We are actually in Florida today at the same place, different parts of the house, and off a big Buckeye win because they're headed to the national championship. They're going to go all the way, OHIO, and we are kind of like fangirls over Peter Hyde. How do I say it? Herb Street.
Herb Street.
And
our new golden retriever mascot.
Yes, he is the director of Snuggles.
I know.
He has a title and he wears it. And
we would love to snuggle with him.
He goes to all the games with his dog owner, who's actually a Buckeye. So we are fangirls. So we hope someday to have Peter on here. Shout out to Peter.
Yes.
And what else? That's it. It's beautiful down here, cold up north, cold in the Midwest.
I think my little Annie is a big fan too of Peter.
She's sweet on him.
Yeah.
She's sweet on him.
Yeah, she's sweet on him. Yeah.
I have Gidget. Gidget is right next to me.
Actually, Annie's sleeping on the couch right now.
Gidget's on his bed next to me, but you can't really see her. So anyway,
she'll be on the show later. Yeah.
We're excited about today's show because a lot of people, a lot of pet owners, their pets are scratching. And there's a lot to be said for allergies. I think you told me once that like 75% of dog issues are dermatologically related.
Yes, it's the number one reason why people take their pet to the vet.
There you go.
And also, Janet, I want to today, in interviewing Dr. Rothstein, dispel some of the myths that people might think are true with allergies, because allergies in people differ from allergies in dogs and cats. And so we need to go over those few similarities, but majority of them are differences. Let's welcome Dr. Emily Rothstein. I'm so happy that she's joining us today because today is all about allergy. Allergies in dogs, allergies in cats, how it differs from allergy in humans, all that stuff that we've been getting questions about. So Janet, why don't you start and welcome Dr. Emily.
Everyone I meet is their pet is scratching. Like there's so much itching and scratching going on. So as a pet owner, how do you know if it's really an allergy? Like let's talk dogs first, so we can break it down. So how do you know?
Well, it should be excessive in your mind, and I always tell clients that if you see hair loss or redness, then that's certainly excessive. But you don't always see hair loss and redness. If they interrupt their activities to scratch, take them for a walk and they have to sit down and scratch, or you're playing ball and they sit down and shake their head and scratch, that's too much.
Oh, that makes sense, because my friend Ann just adopted a rescue and the dog kept shaking its ears, and turned out it had, and she took him right in and had a yeast infection in her ears. So that makes a lot of sense. So, so say I've got a pet that's scratching, but I get him treated, right? And he's fine. Does the scratching become like a habit?
No, I don't think so.
No. Okay.
I always tell clients that they don't know, dogs and cats don't really know about those kind of habits. They know that going out to the bathroom, that's a habit they get into, but I don't think itching, scratching, licking their feet, I don't think that's a habit. I think something.
You know what else they know as a habit? What? If you feed them at the same time every day, they're like, hey, it's 5:02.
Daylight savings time is a killer.
Yeah.
We never have had a regular feeding time with any of our pets because it made me nuts.
So,
Oh, we do here.
Yeah,
It's
they
like,
know. They wait for. They're like,
yeah, you're late, lady. You're
get
late.
on it.
Yeah.
So my friend's dog Rosie, who's a rescue, who's gorgeous, around
what
age
breed,
4.
Janet, what breed is it and how old is she? Because that makes a difference.
It was a mutt. She was a mix.
How old?
Oh, okay.
She was a mix. She kind of looked a little bit like a Doberman Pinscher, that coloring, but didn't have that look. Her coloring
How old?
was,
How old?
well, at around age 4, she was this
Oh.
very vibrant dog, and around age 4, she developed some kind of allergy. I think it was to the grass, some kind of something she was ingesting. So, if they don't have it when they're born or when they're puppies, can allergies develop later?
Yeah, I mean, that's how your immune system works. It looks at something over and over and over and doesn't care. And then all of a sudden there's a switch. And usually in environmental allergy, it's a genetic switch that turns and says, ooh, now grass pollen makes me itch, or now mold spores make me itch. But usually for the environmental stuff, it's usually kind of between the ages of 1 and 3 in dogs. But it depends how old the dog was in the location that she lives.
I would also have pet parents that brought in a dog that had runny eyes or nasal discharge and say, he's got hay fever. And yes, that can be a symptom, but it's not a real common symptom like it is in you and me. That usually ends up being something else. So people try to equate what's going on in a human with the same symptoms in a dog, and it's not always true, and for the most part it's not true. I mean, I'm allergic and I don't lick my feet
Or your hands.
I've seen you doing it.
And I have horrible hay fever, and I never have had an ear infection like dogs get.
See, there you go. That's right.
So,
But I want to tell Janet and the audience, Emily, one of your labs I knew personally. Tell that story. It's such a small world.
Such a small world. Well, there aren't many dermatologists like us to begin with.
That's true.
But
especially at the time. Yeah.
so Garland, who's sunbathing somewhere in the house, she likes sun puddles. Garland was, I think, 8 months old when I was contacted by Guiding Eyes, because I'm on somebody who will adopt medical releases because they need a home, so they might as well live with a veterinarian. So I was contacted, and they said, we have this beautiful black lab who's gone through some training and everything is really great, but she gets ear infections all the time, and we can't have a guide dog scratching their ears. And she has runny eyes sometimes. But the ear infections, I think, were the biggie. So come to find out, I said, yeah, I'll take her. G was the next letter of the alphabet for our dogs that we were adopting, and there's a whole story behind that. And so I got the medical record, and who should be its local dermatologist but Alice. So I contacted her. I said, is this the best dog ever? And she said, yes. And she is. She just turned 10.
Oh, I'm so glad. Is she in good health?
Oh, yeah. Yeah. She eats prescription food, and that solved all her problems.
Thank God.
So
and Janet, that's another good point. When young dogs, like under the year of age, start to have issues, it's usually food related.
Oh.
The very young and the very, very old, so over 6 or 7, 5 or 6 or 7, you think food first. Food allergies first.
Now, what is medically released?
Medically released means that because of a medical issue, they will not be a suitable guide dog. Sometimes they can place them in other therapy. Like I have another one from Guiding Eyes who, unbeknownst to them, was injured very, very young, maybe 4 or 6 weeks playing with litter mates, and then became lame, and then they finally x-rayed her, and she had a fracture that was not really amenable to fixing. So she had a little limp, and they first placed her in a New England service group. I forget the name of it now. That they would have trained dogs with kids in wheelchairs or special needs for whatever reason. But the limp got worse, so they returned her to guide dogs, and they contacted me. And she's right down there.
Wow.
She just turned 12.
What's the story on the third one?
The third one.
Uh-oh.
The third one is also from guide dogs.
Okay.
That's good.
Boy, they know who to
Yeah.
call.
I'm a sucker. And I'll have to tell you the naming story. But the third one is from Guiding Eyes as well. He was not a medical release, although I think he should have been because he had wicked diarrhea and he's on a prescription food. But he was released because he was loud noise phobic. You know, so if he was placed in a city and something went bang,
Yeah.
but he's not that way with me. But I think also he was raised during COVID, and the way they train these dogs when they're young is so amazing. God bless those puppy raisers to deal with them for 2 years, and then they have to give them up. But so he didn't get to have all the exact socialization that they would have because people couldn't be around each other. But he and his name is Fresco, as in eating al fresco.
Let's go.
So if you notice the names of those dogs, Holly, Garland, Fresco, in that order. My first dog was Lancelot when I was pre-vet. My second dog was Katie, okay, K-L.
So you're going backwards.
My next dog was Jasper, just as a fluke. He was adopted. Then we got a cat. I found a cat behind my office, and we named him Iggy Pop. So that was the I. And then Holly, but her real name was something different before they sent her to the special needs place. So they called her Holly, and that's how she grew up. So then Holly, then Garland, then they told me they have this dog named Fresco. And I'm like, it's a given. I mean,
Meant to
so
be.
if I get another one, it has to be an E.
You know, it's funny, Emily. Yesterday I was telling Janet, we were talking about being in an MRI machine, and Janet freaks out. And I said, when I was in one, I recited the alphabet backwards. So see, you're already very good at that.
Although we did,
But it's meant to be a distraction.
we had one exception, which was Mocha, but she was adopted from a relative, a long story. So she was at the end after Lance, but yeah. So,
After Lance, yeah.
but they all
Kind of out of
they all
place
eat
there.
prescription food. Aren't I lucky?
Yes.
Now, for our listeners, if your dog is put, like, as a dog owner and someone goes, the vet says, well, it has to go on prescription food, I'm sort of like, whoa, right? Like, can I still give them the fun treats? And can pepperoni be in their diet? So how do you address that with patients?
It can be very hard. So there are a couple of ways. One is most prescription diets come dry and canned formula. So there are little recipes you could make treats out of the canned formula, kind of like slice and bake cookies. You take the lid off, plop the can like cranberry sauce, slice it up, bake it in the oven until it's dry. There are vegan marshmallows, which have no gelatin, animal gelatin protein, because people say, oh, it's just a little bit, but allergy is an all or none. In a recent study, they found that about a teaspoon to 2 is all it might take to set off the allergy.
That's not much.
So a kernel
like in a big dog or
popcorn,
a big
if they're
human.
allergic to corn, and you give them popcorn when you do movie night, nothing passes those lips but water and
So
food.
are the vegan marshmallows, it's a human food?
Yeah. It's human, because people that like marshmallows don't eat them because there's gelatin, and gelatin's an animal product. It's pork or beef.
I didn't know that. Huh.
But they'll say,
Interesting.
can I give it? Oh, we always give them a carrot when they come in from the potty. Nope.
I was going to say the thing that I noticed most about pet parents that really follow a strict hypoallergenic diet for the dog is if they have allergic children. They know how it only takes a smidgen to set
Oh,
them off.
wow.
And the most success I've had with food allergic dogs, and especially labs, I have to say, Emily, with ear infections, is I remember having a dog, a black lab, on a venison diet, one of the prescription diets, and I said something to the young mom, and she said, "Oh no, I get it. My son has severe food allergies." I was like, "What a pleasure it is to deal with you." Because, like Emily said, Janet, people think, "Oh, he just had a little bit of cheese." That
Right.
sets them back 2 weeks. Two
Yeah.
weeks.
Or the
Well, today we had our dog, which does not have allergies. Libby ate some deer poop. So, she dines, as you say, Emily, al fresco. And I know she doesn't have allergies, but, those are the things, too. You don't know what they're doing out in the yard.
can't-
So you have to be
Especially
really
cats.
careful.
yeah, especially
Yeah.
that's with cats. You can't let them out because if they're allergic to mice and you change their main diet, but they still eat and catch and eat mice or chipmunks or whatever, then you ruin it. And it's a protein that's usually responsible. So everything has protein.
Huh.
I guess, I don't know, maybe lettuce doesn't. I never really looked.
Blue Buffalo Natural Veterinary Diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo Natural Veterinary Diets.
Now there's soothing relief for your pet's irritated skin from allergic response, contact allergens, and insect bites. Atopicreme HC by Vetramax is a unique anti-inflammatory, rehydrating leave-on lotion conditioner for animals that is quickly absorbed, providing sustained benefits while leaving no residue. Fortified with ceramides, these lipids help restore the skin's natural protective barrier and aid in healthy skin regeneration for your pet. Atopicreme HC is made in the USA and not only provides quick relief for irritated skin, but it's also an aid in detangling your animal's coat. Ask your distributor about Vetramax products. Vetramax makes it better.
Okay, so I'm a pet owner. My dog has been diagnosed to have allergies. What happens next at the veterinarian's office?
Well, first of all, wait a minute. Emily and I need to talk about how to diagnose. Let's do food allergy, because
Okay.
so many people are spending hundreds of dollars on these blood tests for food allergy. I'm helping out the Golden Retriever Rescue. Yes, thank you. That and retractable leashes.
You mean like over the counter?
double,
No, wait,
double.
But you mean like those over the counter like food sensitivity tests? They have them for
Yeah,
humans.
well,
too.
yes, or there are some that
There are some-
the vets run
Yeah,
as well.
veterinarians can
Yeah.
run it, and we can't tell them enough that doing, and there's a big scientific reason behind it, but doing a blood test for food allergy does not work. Doing a blood test for environmental allergy to do allergy shots can work, and there's some discussion about that. But the first thing we do is, what is the age of onset that the problem started? That's why we kept asking you what the age is, because certain things happen at certain ages. What symptoms, and is it year-round or seasonal? In some places you can't tell, like Florida. I don't know,
Yeah.
but up here we
Yeah.
definitely have seasons, so you can tell when it's a problem and when it's not. So
So do they do the scratch tests like they do on humans?
not really scratch, it's an injection. So the animal, and this is only environmental. So let's
Right.
finish food. So you have a
Okay.
8-year-old dog that comes in that has ear infections, never had a problem before. Your veterinarian suspects food allergy. You treat the ears, you do a food trial. After 2 months of this strict food, then you decide, do you want to know, was it the food that fixed it or something else? So you do what's called a challenge. Now, I've had numerous people that are like, nope, I don't care. I'll buy the prescription food.
Same
I don't
here.
want to mess with it. I don't want to
Right.
know if it's chicken or turkey or beef or rice or whatever. I just my dog is fine, and if it ain't broke, I ain't gonna fix it. So, but if you have a dog,
And I agree with that.
well,
Yeah.
look at me. I'm spending on all these doofuses.
I don't even want to know what you're spending. Hey, and speaking of which, just changing from one over-the-counter food to another that's not the test. The over-the-counter foods have other proteins in them, even though it may not be listed on the label. So it's very important that they do a prescription hypoallergenic diet, because those are DNA tested during production and at the end to make sure there's no other contaminant proteins
The
in
other
there.
problem
Yeah.
with all these over-the-counter foods is a lot of the proteins that are in the prescription diets that used to be considered novel or new to animals, everybody and his brother made a diet with those same proteins. And so the client may have tried a bag of venison, a bag of rabbit, a bag of this, a bag of that, and now we don't have anything new to try for this dog. So sometimes we use what's called a hydrolyzed diet, which is food that's broken down to itty bitty bitty little proteins that supposedly the allergy radar won't detect. Or sometimes we have to go even harder, which is a home cooked meal, which if you have multiple pets, they're either all eating the same diet that you're cooking or buying.
I'm thinking of Dr. Rothstein cooking for 3 black labs, like in a big kettle.
We had 4 dogs at one point, and to feed them, it was so funny because I'd have all their bowls stacked up, and they all knew because they were guiding, 3 of them are guiding eyes, and they have very specific rules before they eat. They have to, you tap the bowl, they have to sit, they have to wait for you to say free before they eat. So today, twice a day, we still do that. So it was okay, but I can't imagine having 4 crazy food starving Labradors. So if you though bring in a dog that's between 1 and 3, and it's the first time it's ever been itchy, it fits into either category age-wise, because food can happen at any age. Environmental, they typically need at least 1 season to be exposed to something before re-exposure. But if it's October of the first year it's ever itched, you don't really know. Is it year-round and more likely to be food, or is it something that's in October, like leaf mold or late blooming weeds? And so sometimes you have to just treat the itch and see what happens when the season changes, if you're lucky enough to have seasons.
Wow.
And you know what's also interesting, Janet? A lot of people will come into Dr. Emily's office or to my office and say, I want to know what my dog's allergic to. Well, my comment to that is, sure, I can test your dog, but do you really think you can avoid house dust mite? Do you really
Right.
think you can avoid fescue grass? You can't. So unless you want me to make a desensitization, or we call it immunotherapy, allergy injection or oral drop, which over time can help desensitize the pet, knowing what they're allergic to, really, if you want to spend the money, okay, but it's not going, you can't
That's
avoid
exactly what
That's
I would say. I'd be happy to take your money, but it's not going to help you. I can give you free
Well, no.
advice on things to do about house dust and house dust mite. I can give you handouts that discuss that, but if your dog's allergic to grass, are you going to keep them in the basement forever? No. So
Yeah, yeah.
knowing only helps to help with the therapy, the immunotherapy, the allergy serum.
I had 2 humans in my house allergic to cats, a little bit to dogs, and dust mites. And they both went through immunotherapy with great success. But there was no way. I had all those things, the covers for the mattress. There's no way you can eliminate dust
Right,
mites.
you'd have to get rid of
No,
It's impossible.
all the
Plus, when you
blinds
travel,
and
how are
the
you going to do
plants.
that?
But that's another good point about the difference between animals and humans with desensitization. In humans, there's usually a finite time period that they're used, and then their people are considered cured or whatever. It
Right.
does not do that in animals. If they respond, then they get it forever. They have to keep
Yeah.
a little bit of that going to keep the cells busy or in tune with what they're trying to do. So they
I don't know why God did that. Why did God have humans outgrow their allergies and dogs and cats grow into theirs. It's just not fair.
Backwards. I know.
Wait,
It is
let's
backwards.
call. Let's put in a call.
Cool.
Hello, God. Why did you?
Oh, okay. Okay, so let's talk about cats. Because I'm assuming, as allergists, dermatologists, y'all are, there's a difference there, right? Between cats and
Cats are
dogs
not
and their
little
allergies.
dogs, correct? They're a little bit similar in that it doesn't start from day one. You know, there's an age predilection. Cats do a really weird disease called eosinophilic granuloma complex. So anytime it's a complex or a syndrome, you know that we don't understand every bit about it. But
That's a good
it's
point.
a bunch of clinical signs that tell you that cat has allergies. Doesn't tell you to what. Doesn't tell you whether it's food or flea or environmental or a mix. But if we see that on a cat, then one, we know it has allergies. But then they also get the same itchy scratchies that dogs will get, and lose hair and get red and get scabby. So and the same thing. The age groups are a little bit different. Food is usually under 2. But anyway, so would go through a food trial if it's a non-seasonal itch. If it's a seasonal itch, you have to decide, do you want to do immunotherapy? Okay, what goes in it? That's where the test happens. And instead of the scratch test like they do in people, they actually get sedated and you have to shave fur. Obviously, you got to be able to see the skin. You got to be able to see the little hive that's created when you actually inject the allergens in. So
Wow.
so that's why we sedate them. Most animals don't think it's funny after you poke them 2 times, let alone 60 times. So and then you can make
But
a
you,
serum. But there also ways to treat. Remember we talked about in October, if you're waiting for something to happen, you know, maybe you'll do a food trial or maybe you'll use a medication to see what happens when winter comes. And there are a lot of good new medications. We used to do, Alice and I were talking, we used to do antihistamines. I remember when I was a resident, there are about 8 different human antihistamines. There's no such thing as a dog one. You would try each one for 2 weeks based on what this person's schedule, because some of them were twice a day, which most people can do, but some had to be every 8 hours, and most people that are working aren't home in the middle of the afternoon. So we would try one for 2 weeks, another for 2 weeks, another for 2 weeks, another for 2 weeks, and you know, they had to want to play the antihistamine game if they wanted to go that route, or there was steroids or cortisone, and that's kind of all we had early on.
yeah.
And then the next thing that came out, cyclosporin, which is a very good drug, very effective, but it also took maybe 4 to 8 weeks to work. So
Oh, wow.
you'd have to say, all right, do I play an antihistamine game and cyclosporin? Do I do some prednisone and cyclosporin? So there wasn't a whole lot out there. Oh, an allergy serum can take up to 12 months to be fully effective. So there was no quick fix but steroids.
Wow.
Which is so sad, really.
But now we have
And
But it
Janet,
makes the pet feel better pretty quickly.
with steroids.
Yeah.
and that's what every pet owner wants. But the problem is, no es bueno. It's not safe.
Not
Right.
for the long term. It can trigger diabetes in cats that are genetically predisposed to become diabetic. They can cause liver problems, kidney problems. They can make your hair fall out.
Wow.
So finally, there are 2 new medicines in the last, I guess one's Apoquel's 10 years now, maybe.
Yeah, probably.
Cytopoint. So 2 new medications, actually 3, but 2 new medications came out. One is a pill form that works as fast as steroids do, but without all the scary side effects. The little bit of a downside is you have to still monitor their body with blood work. And they're not as cheap as steroids. Steroids are pretty cheap. And then another is actually a shot that goes after and tries to capture the one little component in the dog's body, and this is only for dogs, in the dog's body
Right.
that triggers the allergy. So it's very targeted. It's very specific to go and grab it and destroy that one product in the body. And that works in 1 to 3 days. So it's still pretty quick onset, usually 1 day. It's pretty quick onset.
Yeah.
But again, if you have a 90-pound Labrador, it's expensive. So
Yeah, it is. You're
allergy,
right.
So what's the most common allergy in dogs, and what's the most common allergy in cats that you all have seen in your practices?
Well, inhalant, I would say dust mite, and I
Yeah.
think that's been proven
I
in
think
humans
that's
as well.
even worldwide is dust mite.
Yeah.
Wow. And those
Yeah.
little buggers, you just can't get rid of them. They're everywhere.
You know, Janet, when Emily was talking about antihistamines in cats, first of all, Emily, Janet can't pill her cat for love or money. And secondly of all, antihistamines are bitter. So I always tell people, you'll get the first one in, but when you come in that room with that prescription vial, shh, that cat's out of there. Because
Yeah, they drool and then they go and they
Oh.
fling their spit all over. And
it's
Oh,
horrible.
God.
and then
It's horrible.
a lot of times, even if the owner goes into the room where the bottle is, the cat's under the
Yeah.
bed. It doesn't make for a happy household. And we're trying to
No.
help. We're not trying to make everybody miserable.
Well,
I
even
have
when-
to say, yeah, I have to say when I would talk to pet owners, cat owners about allergy testing their cat, and okay, and then we're going to make up an allergy shot to desensitize, and we used to do ours, Emily, at once a week, you know, so that it wasn't every 3 days, it was once a week, and we're going to teach you how to give a little shot on this given week. That, Janet, that was the exact reaction, but
Yeah, I don't
as
think
I'm-
so.
as I'm giving what we used to call the dummy shot of just normal saline, teaching them how, and we're talking, they say, well, when are you going to give the shot? I'm like, we just did that 5 minutes ago. It was incredible to see how many owners. I actually had one woman who was so afraid of needles become a nurse after giving her cat a weekly allergy shot. I was so proud of her. And I have an 80-year-old woman that the cat is on allergy shots and doing fabulously. So to me, it's easier to dread 1 day a week giving an allergy shot than once or twice a day trying to get that pill down that cat.
Oh, wait. I had the diabetic cat.
Oh, that's right, you did.
Oh, my God. For like 10 years, I swear to God, that cat.
You did a
And-
good job. I have to give you credit.
Well, and here's the thing I did, and here, pet owners, so you know this. It was not a death sentence. I was like, you got to be kidding
Yes.
me if you think I'm going to give that cat a shot twice a day. First of all, you have to get the cat to eat because they have to have something in their gut, and then you
Yeah.
have to give the shot. Well, it was hysterical. We discovered that the top of the dryer, which is flat and my level, we would put like a beach towel down, and then I'd put that disgusting, stinky, wet food, and Smudge thought that was heaven. And it got to the point where she would go, because she knew it was coming, in the back of her
Aw.
neck. And everyone in our family was trained because otherwise, if I wasn't going to be home at the right time to give it 12 hours later, somebody else could. But it became, did you shoot the cat today? That's what
Yeah.
we would say. But I'm very proud of my family for doing it because I remember calling Alice going, there is no freaking way I'm going to be able to do this.
I know.
There's no
Well, you
way."
know what? It's just like the word cancer. When
Yeah.
the pet parent or us first hear it, we're like, oh my God. But then as you get your wits back about you, you're like, I can do
Yeah.
this. Yeah.
Well, our dad had he became diabetic because he had cancer. And
Temporarily.
He had to give himself insulin. And I remember being with him in the hospital, and they trained him in an orange. Like to do the shot part. Because if you've
Which
never
I
done
don't know if anyone's skin is as thick as an orange rind.
But it
Think
was
about
a
it.
way to learn like the pressure and everything. Because
You should actually use a chicken leg, a raw chicken leg.
But then wait a minute. Then I had to give that cat sub-Q. I know what I'm talking about. Fluids. And that was like, I had to get her, and she was a chill
Don't
cat.
be trying
thank
to
God.
impress us throwing around
The
veterinary
sub Q.
lingo.
I'm going to go give her the sub Q, but I was the only one in the house to do that. But that was like terrifying the first few times. But she would just hang out with me. She didn't mind it at all. I think she knew it made her feel better.
I have a question for Emily. Speaking
Yeah.
of cats and allergic cats, and we know that, bathing, like if I'm outside raking leaves in the fall, and if I don't come in and shower and get all that pollen and leaf mold and stuff off of me.
And ticks.
Yeah, okay, yeah, that too. But my question is, Emily, how many of your pet parents actually bathe their cats?
Oh God.
I mean,
I probably
can't
had,
imagine
I
that.
probably had like two, you know.
Yeah, in 25
Yeah,
years.
people would say, "Oh, my cat loves a bath." I'm like, "Excuse me?" But very rare, which is why it was good when they came out with wipes and mousses and stuff you can apply
Yeah.
because some cats will let you do that, but get them near water. Talk about cat and human torture.
Well,
I
our
know.
cat walked in wet tar, and we didn't want her to lick it off.
Oh,
And so my son Kyle and I had the rubber gloves on, and he held her, and we used that Uber Dawn, that spray, and we like rubbed it in like this, and she was kind of like this, and then we massaged, and she kind of got into it a little bit quick. It wasn't like a pedicure, but she kind of got into it because I think she knew it was going to make her feel better.
I don't know that they know that, but
Yeah.
you can believe that.
I'll believe it,
It's a nice
but
thing
I
to
would rather
believe.
give my cat a pill than give it a bath.
yes, I agree with
Yeah,
that.
cats just are a different species. They're themselves. So
It's
And I
their
feel
way or the
bad.
highway.
I feel bad, like allergy speaking, they're still kind of behind the eight ball. I mean, I wish, Emily, I wish we had more, how can I say, more research
yeah.
into cat allergies
yeah.
because we still don't have the stuff we've got for dog allergies. The Apoquel, the Zenequel, the what is it?
Zenrelia.
Zenrelia, thank you. And the Cytopoint and all those and the immunotherapy. Although we do have immunotherapy for cats, which I have to say, I love immunotherapy in cats. I think they do better than dogs. I really
I
do.
think they do better and faster, just like cyclosporin.
I agree.
Cyclosporin in cats.
Wow.
They do better, faster, and can decrease their dose better than dogs. But I don't know why
Yes,
there's not
I-
more cat research. In the back of my mind, I keep thinking it's because for so many years we had long-acting steroid shots. And so
I
you
know.
could give it a shot and it might be okay for a while, but then they get
Yeah.
diabetes or they get whatever.
Or heart failure.
Yeah, or heart
Yeah.
failure. And I think
Yeah.
people just weren't, I don't know, I don't know why there's not more research for cat allergy treatments.
Because I'll tell you why. Because the cats would have to request it and be the boss of it.
That could be. The cat,
That's
Well,
why.
and also, you know what? You also have to have the right owner to do immunotherapy allergy shots, be it a dog or a cat. Because I remember, Emily, when I was in general practice, I had a cat that came in that I knew had environmental allergies. And I started talking to the owner, there's some other, I don't want to hear about it, just give him the shot. And
Yeah.
that would not be a good owner because after you give the desensitization shot, you build them up to a certain level. You need to keep an eye on them for that week. Were they itchier? Were they better? So you've got to have, for this to work, you got to have a pretty observant owner and one that has a lifestyle that they're not traveling all the
Right.
time. I
Right.
gave the shot on Sunday. I left town. I got back Thursday.
well,
Yeah.
yeah, I think they have to be, and it's a hard discussion with cat or dog parents to go through all this, and people are like, I'll do anything, and I'm like,
Yeah.
okay, so if we do I can't do that.
No, I know. Janet, we hear that. Listen, if we had a dime for every time the two of us heard that, I'll do anything, and then except that.
Or the other one I always heard, it's not food allergy, they've eaten the same food their whole life. And
I know.
that's the immune system all of a sudden turning a switch and saying, I do not like chicken and rice anymore. I will make you itchy. If everybody that says, it's not food allergy, I'm not going to do that. It's not food. I'm like, when did you go to vet school?
So our
Well,
pet owners need to be open-minded.
And you know what I say? I say, we think about it. We all know someone that used to be able to eat shellfish,
Yeah.
and then all of a sudden you're out to dinner with them, and they blow up and they have trouble
Peanut
breathing.
butter.
Yeah.
It's the same
Peanut
mechanism.
butter. I
They just
ate
can't.
peanut butter so much as a kid, and maybe when I turned 50 or 55, I got allergic. Right before the meeting in Tennessee, I got allergic to peanuts. And I had to try going to an airport when you have a new peanut allergy and reading all the labels and the cool
Oh my gosh.
food. But yeah, I had never been
Wow.
allergic to peanuts or peanut butter.
Wow. And it's also if someone's touched it,
If for,
not
Oh,
just
right.
in
for
the
people,
food.
yeah.
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 Yeah, but
Wow.
Emily's right. You'd hear so many times, oh, it's not like, don't even talk to me about food because he's eaten the same food for all these years. That's the exact thing. The body says, I'm done with this. I've had it. I'm turning on it now. And that's food allergy.
Wow.
Yeah. And also, you can have, Janet, you know how sometimes, and I don't want to bring up personal issue, but you know, sometimes you have gut issues. Not only is it itching or ear infections, but sometimes they have what we call GI, gastrointestinal problems.
Correct.
That and skin problems.
Yeah,
So,
they can have either or both. I mean, some
Yeah.
food allergic dogs or cats won't come to us because all they have is vomiting or diarrhea. But we will see
Yeah.
and ask about if they're itchy and we're suspecting food. Does your pet show signs of vomiting or diarrhea or loose
Right.
stool? Because that's almost more support. You know, put this in the check mark column for food possible when you have multiple symptoms.
Blue Buffalo Natural Veterinary Diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo Natural Veterinary Diets.
now there's soothing relief for your pet's irritated skin from allergic response, contact allergens, and insect bites. Atopicreme HC by Vetramax is a unique anti-inflammatory, rehydrating leave-on lotion conditioner for animals that is quickly absorbed, providing sustained benefits while leaving no residue. Fortified with ceramides, these lipids help restore the skin's natural protective barrier and aid in healthy skin regeneration for your pet. Atopicreme HC is made in the USA and not only provides quick relief for irritated skin, but it's also an aid in detangling your animal's coat. Ask your distributor about Vetramax products. Vetramax makes it better. You know, Janet, you're lucky. In all the dogs you've had, none of them were allergic.
No, we've done okay. We just had the diabetic cat,
Yeah.
which wasn't easy. But you know, you just don't know when you get a pet, whether it's pedigree or rescue. You just don't know what you're getting. Like a human,
I was
you
going
just
to
don't
say,
know.
just like people, and once you get a pet, they're yours for life, just like people. So you got to
That's
do what
right.
you got to do. and
I
what
always
you're
say,
able to
don't
do.
get one if. Yeah, and don't get one if you're not able to send it to college.
Yeah. Or to buy him a car with, oh no, forget to buy him a car.
Now,
Emily,
what about
what foods are in your food pantry right now, dog food wise? I'm interested. This has got to be a big pantry.
I have the two girls eat Royal Canin moderate calorie whitefish because they're Labradors.
Okay.
And Fresco eats the Royal Canin duck and potato.
Duck and
So
potato.
Garland ended up being allergic to chicken because I did challenge her.
Yeah,
And
good.
Holly had mainly GI issues plus her shoulder. And Fresco, I don't know if I ever challenged him because the reports with the diarrhea were pretty rampant in his medical
Yeah,
record. And
who
I
wants
thought,
that?
you know what, he's 90 pounds.
Yeah.
If duck does well
Yeah.
by him. Oh, I did challenge him with over-the-counter duck once.
What
He
happened?
got diarrhea.
Yeah,
Because
see.
sometimes
Yeah.
there are proteins in there that aren't on the label.
Well, and Janet, this is something. Emily, I'm sure will agree with this. I'll get people in that say, "Well, he can't have chicken." I read all the labels. Here's the problem. There was one study that said 83% of what's on that label of over-the-counter food isn't accurate. So it may not have chicken on that label, but 83% chance there is chicken in that food. Scary.
And it's not like I had to, the cat that was diabetic had to have a certain cat food, dry and wet, a prescription. And it wasn't like, I remember going, oh my God, they're going to be on prescription food. It's like I'm going to be going, to the fancy grocery store. And it wasn't prohibitively expensive. It really wasn't. Because as a patient, I was like, oh my God, here we go, right?
Yeah.
And it wasn't that bad.
Well, plus
It was
the
very
idea is by using those special foods, you're not taking them into the veterinarian for recurrent ear infections or skin infections or glucose
Right.
curves that aren't controlled or whatever. You're saving all that money that you would be going
Yeah.
back and forth, time, gas, all that your pet does well.
Yeah.
And you're getting to the root of the problem.
that's-
Instead of dumping ear medicine in those ears 24/7, 365 days a year, it's the food. So feed
Yeah.
the food, and maybe there's some environmental allergies too. But when you get one allergy under control, it really brings down the threshold for, or would it bring up the threshold? Anyway, it
you're right,
lowers the
drops
chance. Yeah.
because it's additive.
Right.
So food allergy is
Yes.
this much itch, environmental is this much itch, and if you can drop the food, you drop everything down, then you're helping a lot. So
Now, I go to my regular vet, like my general practitioner, so to speak.
In
Can they
Connecticut,
treat-
by the way, Emily. She lives in Connecticut.
Can they treat an allergy, an allergic pet?
yeah.
Or do I have to go to a specialist, a vet derm?
Well, you don't have to, but a lot of times you will get maybe faster results than a general practitioner that doesn't do it day in, day out, day in. They do kidney disease, liver disease, urinary tract disease, eye disease.
Everything.
Don't ask me about eye problems. So
Right.
we have tunnel vision, and they do everything. So they certainly they have access to everything that we have access to, except what's in here.
Now, how can our listeners find a veterinary allergist or
I'm
dermatologist?
very glad you asked that question.
Queuing you up.
If you go to ACVD, which is American College of Veterinary Dermatology.org, at the very top of our new well-designed, thank you, I had a hand in it, well-designed website, there's a little thing that says find a dermatologist. Click here. And
Great.
you put in your zip of your state, and it takes you to everybody within X amount of distance from you worldwide, because there are some people in Germany and Switzerland that are board certified by the American College. So
Now, this might be a dumb question, but say I'm a horse person. Is that a different vet derm than a small
no, but most of us do more small animal, and there are several that do a lot of large animal. And then most of us, like I had an office, but I maybe did a horse every 2 or 3 years, which I love because I love horses. But, it's not like they can bring them to you. So you do a house call.
Yeah.
And there are people that are better at it than me. Because not quite in my wheelhouse, or wasn't quite in my wheelhouse. But you can allergy test a horse. I've done that. You can do a food trial in a horse, which is hard and not very common because,
It's a lot of food.
well, you have to change their hay and you have to change their grain source, and there's only a couple sources, so it gets complicated. But yeah, so veterinary dermatologists can do all species. There's a guy in Pennsylvania who likes fish. He does a lot with fish. Like, they're not show fish, but fancy, like koi pond fish.
Yeah.
And,
They have allergies to
no,
what?
I don't
Seawater?
think they have allergies. They have
Oh.
skin problems. So we do not just allergy, but anything that relates to the skin and nails and hooves and scale. Skin.
I was going to say, is it called skin on a fish?
Yeah,
I guess it
it
is
is.
skin.
But its skin's
Wow.
covered by scale.
Scales. And maybe not if it has an allergy.
Or if they have ick or some fungus.
Yeah.
But
And they get a lot of skin tumors too.
oh, really? That I didn't know.
Really?
Yeah,
I know rats get tumors.
yeah,
We do rats.
Wow.
We do pocket pets,
yeah.
bunnies, chinchillas, hedgehog,
Ferrets?
ferrets, if they're legal in your state.
Why you're turning up your nose, Janet, when you say ferrets? Ferrets are very sweet.
I had a college boyfriend who had a pet ferret.
Is that?
Oh, we won't get into that.
Never liked it. That thing was like a
Oh.
little.
It's a weasel.
Okay. Well, Dr. Rothstein, we have to ask our questions that we ask all our
Okay.
guests. One, what are you passionate about in your field? And secondly, like what turns you on? And then secondly, what is your pet or human peeve? Like what turns you off?
So what am I think the best thing, and I hope I can say this, my mentor used to say, when you would find scabies mites on a skin scraping in a really itchy dog, it was orgasmic. It was so exciting because
Yes.
they're very hard to find. They're very hard to find. Usually you treat a suspect, but you never find the mite. So if you find the mite, you run around the office, yay, I found it. So that was always fun.
So we need to get the bumper sticker, scabies turns me on.
Hey, good
You probably
idea.
sell a ton of those at a derm meeting.
I think we should get that for Orlando,
We
Emily.
could get the little things that you put on your badge, those little stickers.
Scabies turns me
That would be.
Scabies turn me
and
on.
wait, and Demodex turns me
Yeah.
off.
Look what I've started. Look what I've
A
started here.
multi-million-dollar prospect.
Hey, Emily, before you answer the next question, did you see they came out with Credilio eye drops for Demodex of the eyelash area in
I
think
think I knew they were.
Lodolander,
They were
yes.
gonna-
I saw it on the commercial.
Yeah, it was.
Yeah.
First, it was ivermectin something. Because I had
Yes,
blepharitis really bad last year, and so of course I did the Dr. Google, which I recommend people don't do Google as your veterinarian.
Of course, yeah.
Because I was wrong. I'm like, oh, wonder if I have Demodex in my eyelid margins.
Right.
But no,
You didn't.
just had a bacterial
Oh, okay.
infection. So anyway,
No.
but I forget.
How
Now I
boring.
forget the second question.
Oh, so
your pet
what is your
peeve.
pet or human peeve? Like what turns you off?
You mean relating to dermatology or in general?
Whatever. It
No,
can be anything
anything.
you want to say.
Even turn signals not used,
I
whatever.
think the biggest thing is I hate mean people.
Oh,
Yeah.
yeah.
Any kind of mean person, whether it's mean to an animal,
Yes.
and I hate Facebook because
Yeah.
of all those posts, or whether
Oh.
it's mean
Oh.
to somebody in the grocery store, like, you know, you cut in front of line, or just somebody who's not being nice to their wait staff. There's just no
Yeah.
reason to not be pleasant and nice, and I don't like mean people.
And it's not, no one follows the golden rule. How would you like to be treated like you're treating that
Absolutely.
person? You know?
Yeah, mean
Yeah.
people suck.
Yeah, I'm
And
done.
don't ask Janet about her dental hygienist either.
No.
Because that's another rant.
Here's how you floss. You wrap it around, and then you go in and let me show you. Now hold the mirror, and I look at her. I go, I'm 65 years old.
Well, what I always ask after they do the polishing, and then they'll come back
Yeah.
and floss because there's a little grit. I'm like,
There's that crap in
how
there.
do
Yeah.
they not? How do they do it just right that they're not jamming your gum when they can't? You know, when you're doing it, you can feel, but when they do it, they never hit a gum. How do they know?
Well, the last one when she polished, they do the tops. It was literally like this. Zit. Next one.
Oh.
Zit. Zit. I'm like,
Okay.
that was it.
But
Like,
I
you
want to
gotta
go
get in
one
there.
further. How does the optometrist put someone else's contact
Oh.
lens in? That I can't. I shudder when I think of it. Because I remember when I first started wearing soft lenses, they put them in my eye, and I'm like, oh, how come? It didn't go like that. Oh,
Well,
floss or that.
How Does the makeup lady put mascara on somebody else?
That's another good one.
I've never seen a makeup. Oh, you mean
Oh,
like a
yeah, like when
TV
you
show?
like at
Oh.
Sephora or like Saks and they're and I'm
Oh,
like,
yeah.
When you're on the red carpet, when you're going on the
Yeah,
red
yeah.
carpet
You know.
and they're doing your hair and makeup.
That's true.
well, this has been so informative, and I hope our listeners learned a lot. I certainly did.
I think we're being cut off, Emily.
The producers are going,
No, they're not. They're laughing their butts off.
they're really good at laughing at us,
I know. But anyway, Emily, I can't thank you enough. I didn't want to make it that you and I did just shop talk, even though I wanted to do shop talk. But Janet, thank you for being like a normal person.
No one's ever called me that.
No, that's true.
I'm the
That's true.
background normal
Emily,
person
Janet.
to our. I love talking to her.
Well, I just ask the pet questions that I'm always wanting to ask the vet.
Hey, listen, please email me a picture of the 3 dogs so we can put it on the
I have
show.
a great
Oh, yeah.
picture. They volunteered 2 months ago at the Connecticut Vet Association, had an cardiac ultrasound lab, and they needed dogs. So I took all 3 of them. So I have a picture of them with their heads in the back of the car.
Oh,
I'll send it.
Wait, here's my co-host.
I
Here's
love
my
it.
puppy.
Yes, that's Gidget on the
Oh, look at
Oh,
that.
look
That's
at that.
Holly.
Oh.
She is by my side 24/7.
Anyway, this is Dr. Alice Novotny-Jeroman. Thank you for listening. We hope you learned a lot today about pet allergies, and my co-host,
Janet Novotny King, and my co-host, Gidget Jeroman.
Gidget Jeroman.
Thank you for joining
Signing
us
off.
today.
Thanks. Kiss
Bye.
the pets for us. Bye-bye.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts because we love to have those likes. Thanks so much for listening.
That's actually really good. You could both go bye-bye.
Bye-bye.
Yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetramax Veterinary Supply. Vetramax makes it better.
Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.